Hello everybody. I do recognise a few friendly faces today. Hi everyone. I've been invited today really just to talk about our particular hospital and in relation to car parking and what specifically changed for us since COVID. There's been a number of challenges that we've had to overcome, and actually we're still working through those at the moment. In terms of the services that I manage, it is security and car parking for my sins, but when it says group, that means I manage all of our hospitals. So that's 10 hospitals across our Greater Manchester footprint. And in terms of car parking sizes, it's about 77 car parks that I have to oversee as well. So it's a big programme in terms of our delivery and what we actually manage. And we also have a mixture of contracted and in-house services as well. So it kind of balances the two out there. Okay, so hopefully, I know a lot of you are facilitators, and I know a lot of you might not be involved in car parking, but fingers crossed this gives you a bit of an insight in some of the things that we're working on at the moment. So I thought it would be just good just to give you a bit of an outline in terms of what our services look like and what our site profile covers. Oxford Road campus is our main our HQ, for want of a better word. We have 4 main hospitals on that site, and we have the dental hospital just a bit further down the road, about a mile. We operate 2 very significantly large multi-storey car parks. We also have off-site car parks as well that we have for our staff, which we lease. And we have a very limited surface space in and around our main hospital entrances, which becomes very difficult to manage because most of them tend to be blue badge spaces or 30-minute drop-off bays. So when our capital scheme and estates partners come in and want to create site compounds and welfare facilities for various development works, that tends to be the main area that we lose, which is a significant challenge for us because losing blue badge spaces has a big impact in terms of our service provision. And it makes it really, really difficult for a lot of our patients who require that accessibility. Even from the multi-stories, it does become quite challenging in that sense. Wythenshawe Hospital, this also has a staff car park. It hosts about 800 spaces there, but we have a significant number of surface car parks in and around that area. In terms of Wythenshawe, it's a very old system we have in place there. Barrier operated, pay on foot. For anyone who's been to older hospitals, more often than not the barriers are broken, they're either falling off up because they're not working properly, and the pay machines are also a problem for us. So that's one of the other challenges that we're experiencing at the moment. Trafford General, so obviously the first NHS hospital, we're pleased to obviously retain that. That's a little bit simpler. It's a small community hospital, but it still has a significant surface space that we have to manage there as well. Same with Withington Community, one way in, one way out, so very simple, small car park. And Altrincham Hospital, which incidentally we don't actually have any spaces for that, so that works quite well. And most recently we've taken on North Manchester General Hospital under the new merger arrangements. That is probably our biggest challenge at the moment, and I see some colleagues from Greater Manchester Mental Health smiling at me when I say this, and that is going through a significant redevelopment programme. We're having a new mental health facility built for GMMH, new multi-stories gone up. It's been a very challenging 8 months over there with regards to all the changes that's been going on. So hopefully it just gives you a bit of an outline, just a bit of a profile of when I'm talking about some of the provisions that we have. So it's probably best to give you an outline in terms of what's been happening across our hospital. So over the past couple of years, 3 large acute organisations have merged to create MFT, Manchester University Hospitals. The car parking arrangements that we had during COVID, obviously the government free parking, that caused us a significant challenge. Making all the spaces free wasn't always the best approach to have taken. And that was obviously regardless of whether people had permits or not permits. What we maintained during COVID is we maintained our permit process at the time. So people, although they were getting free parking, if they had a permit, they had to still keep going through that annual renewal process. So we didn't, once we came out of COVID, we didn't have that huge influx in terms of renewals from everybody. But it led to overcrowding within the car parks, and of course we had a lot of issues where patients weren't able to get spaces because the staff were taking up a lot of the free spaces there as well. So our demand was quite high. At our Oxford Road campus, our waiting list was over 1,200 staff there, so you're probably looking at about a 3-4 year waiting list there in terms of the demand, and that's obviously for a city centre hospital. That excluded what we had at some of our community-based spaces as well. So there's been a lot there. There's been a lot through COVID, a lot of people's culture changes in terms of how they get to work, what public transport they use. So that obviously all links in with our whole sustainability agenda as well. And then, of course, the new North Manchester redevelopment as well, and a lot of the legacy issues we had there from the previous organisation too, which had a big impact in terms of what we had to do. So we really started with what were the inequality of the charges, and that was also for the public as well, because Wythenshawe had a different charging rate to what we did at Oxford Road too. So it was how we actually aligned a lot of this. And how that then impacts in terms of our funding, our income. Our Oxford Road campus sits on a PFI profile as well, so it's undertaking a lot of the different challenges within facilities there. And in the meantime, we've still only got a limited number of spaces at the end of the day. Various capital schemes being brought in meant that obviously we lost a lot of our surface car parks. Some of our other off-site car parks were closed to create some of that welfare arrangements as well. And then throw that all into the mix, which I know has been a big topic for you all today, is around the sustainability, our net targets, zero targets, and obviously that's a big profile within our organisation. I am pleased to say I don't oversee that bit, but hopefully you'll hear more of that from next year from our lead, who's sort of put together a very significant strategy across the Manchester profile for that. So big problems to overcome. Big programme of change, a lot of key stakeholder engagement, consultations, working groups that were all actually undertaken pre-COVID. After COVID then, it was sort of building that back up again, making sure everything was still relevant for us as an organisation, and then obviously getting some of that strategic executive buy-in as well from the LMC and staff side there. So the various programmes that we did as part of the task and finishing group was not just about aligning the policies, it was also about all the different charges, eligibility criteria for staff. You know, how do you assess who needs a permit and who doesn't, who can park on site, who can park off site, what makes one staff member more necessary than another. So that was a big programme of work that I had to sort of put in place, and that had to be done for the board back in 2019, but obviously approval was paused up until after COVID. So what I designed was a point-based system. That was the easiest way to actually build a sustainable and future-proofing a permit system for us as an organisation. And that was agreed with staff side and a range of different consultations from a clinical, nursing, medical backgrounds as well. And we went out to tender. Unfortunately, the company that we chose during COVID, they kind of fell and didn't really work out for us as an organisation. So we ended up doing another mini tender for a new permit system. And that had to be built from scratch for us, making it specific to our needs and our requirements based on everything that we've talked about already in terms of the charges, eligibility, and how we actually assess the necessity for some of those permits. So we built that in a very quick space of time. It was about 4 months that it took for us to build that system and have it operational. And we actually have implemented that on a 3-phased approach. So we started back in November. That was when we went live with our staff charges and where we actually went live with the system. So the first approach was integrating that system at our North Manchester site, because as a new hospital into the organisation, we'd taken on a lot of their legacy arrangements. So we were starting afresh with them, which made it a little bit easier for us, but it didn't come without its challenges as well. In June, we've then done our legacy permit systems and the integration from those permits into the new system, and we've just started the final phase, which is the legacy arrangements at Wythenshawe and Withington. When I say it's a challenge, the difficulties have really been around some of the understanding of systems, how they work, people who have always had a permit but are no longer eligible, and it's really about how we communicated some of those elements of changes but made it more specific to some key staff groups as well, so they didn't feel disadvantaged or discriminated against. So the staff charging was probably one of the first and the biggest ones that we had to overcome. And what did that look like? How did we create a level of consistency across the organisation, regardless of roles and things like that, but still working on the government manifesto for the night workers? And how do we not disadvantage some of those lower bandings as well? And we had to build that in to also make sure that, one, we broke even. You know, we couldn't lose money on the car parks. A lot of our income is breaking even in terms of just managing them on a day-to-day basis. So the proposed changes that I put forward to the board following numerous consultations was for core workers, 9 to 5s, 8 to 4s, they would be charged 0.95% of their salary. Okay, so we moved away from a banding structure into based on what your actual monthly salary was. And that went through board approval and staff side. And then we considered, how do we incorporate the government manifesto in the night workers? And the simplest way that we could do it was deduct it by a third. It was as simple as that. And we created the 0.63% charging rate for those who are rotational shift workers. Obviously, permanent night workers and blue badge holders automatically through our system got free parking anyway. So it was just about how we incorporate that in. And then getting in the buy-in from payroll, who had to then facilitate all of this. How did they actually factor in these charging rates month on month in the actual system? So we were very lucky. Our payroll team worked really hard to understand ESR, how the system works, and what we were able to program in. And then we had to consider, well, what about those that weren't eligible for a permit? How would that work? How could we still create some sort of cost-effective and manageable daily rate for them, but also be mindful of the overall sustainability agenda and the Trust's initiative to encourage people to find alternative ways to get to work without using a vehicle. So we introduced a £6 daily rate, and then following various feedback after November, we then introduced a weekly rate of £25 and a monthly rate of £80. Now, you might think £80 a month is quite a lot of money, but we had to balance that against an average bus pass within the Manchester area, which actually valued at £76 a month. So we couldn't make it cheaper than public transport, but we had to make it a reasonable cost, so we just rounded it up to the 80. It was as simple as that in terms of some of those decisions that needed to be made. Okay, and all of this is managed through our salary deduction scheme with payroll. So very, very simple in terms of some of that engagement with our staff. So our permit allocation, this was the next biggest challenge for us, was a single trust-wide system, had to be an online application process, made it easy for people to complete and how they did that, but also managing what do we do with those that were on legacy permits, how do we transfer them in. And we came up with a set scoring criteria. We kept it very simple based on the needs, and it was really working backwards. Who needs an on-site permit, and then working back into the off-site car parks. So it is looking at people with shift patterns, rotational shift workers, for example. Are they an essential car user coming and going throughout the day due to various clinics and related duties? Cross-site working, 10 hospitals. We have a huge range of staff that have to travel on a daily basis across all the sites. Medical condition or disability, that was a big program of work that I was actually doing pre-COVID with our disability group around the Equality Act and how we support our staff with mobility or disability issues, even though they might not have a blue badge. Looking at how far away people live from where they're actually based. That was a big piece of work. And we actually linked that simply to the Greater Manchester Transport Agenda. And it covers 3 areas. It's up to 30 minutes on public transport, 30 to 60 minutes on public transport, and then over 60 minutes. And we kept it as simple as that based on that distance. We looked at what was available for people in public transport. Although some people might live close to the hospital, A lot of our hospitals are also rural, so in terms of public transport routes, it's very limited. So we had to do a lot of work with our Greater Manchester Transport colleagues to understand some of that. And then, of course, the big one within the NHS is the parental and the caring responsibilities. A lot of our staff have ageing relatives that they might look after, as well as young children as well. So we needed to be able to factor some of that into the criteria. And then, of course, on call for emergencies as well. So that was a big process. So we introduced an appeal process, and that was to support staff who were declined a permit, where they had the opportunity to provide further information that as a panel we were able to assess. The panel is made up of HR representatives, staff side, myself as chair, and then of course obviously our car parking managers as well. So we tried to be inclusive with that panel. And then the big piece of work that we did with the disability forums was our accessibility assessment panel. And that was really for a 6-month interim process. How do we support people who need that additional adjustment for work, whether it's coming from an operation or perhaps they've got long-term mobility issues, but they haven't been able to get assessed by employer health and wellbeing, or they're still waiting on an application for blue badges. So that's worked really well, and I'm very pleased to say we've supported a significant number of staff, and we've also reduced the demand on our employee health and wellbeing colleagues as well, with them not having to make that initial decision. So it has worked well for us, and we've got great praise from the forums to support those staff who needed that extra adjustment. So post-implementation then, some of the issues that we had, appeals was a big one. In my original board proposal, I never suggested an appeals panel. It was very much you either met the criteria or you didn't. But when we started looking at the declined applications coming through, it was evident that we needed to factor some of that in and how that actually worked. So we did have to set the appeals process up, but like I said, we only focused on the declined permits, okay? Communication, that was a big challenge for us, was how do we get the message out, made it very clear and simple for people to follow, recognizing that not everyone has access to a computer within the hospital, not everybody has access to the StaffNet pages and the information. So we worked very closely with our comms teams to make sure that we had various posters, QR codes, so people can scan to the system that were promoted around the hospital. We designed a new car parking intranet page that is very detailed and very specific for everybody's needs. And we made sure that that's continually updated as well, particularly with the 3 phases that we were working on, most recently the last phase with Wythenshawe and Withington. We also then had to incorporate NHS organisations. So this was working with our neighbouring colleagues at other organisations like Northern Care Alliance, Greater Manchester. How do we facilitate charging rates for those staff who are perhaps already paying into a car parking scheme? So we had to sort of include some of that programme of work, which we've now built into the system and made it a lot easier for everyone in terms of the application. So that's just sort of some of the system improvements that we've had to do. We've revised scoring, we've looked at reallocation of various holders, and we're also having a look at more details around our appeals system as well. Cross-site process, so that's what I just mentioned in terms of some of our neighbouring organisations and the work that we've done as well. So this is our next steps. We're currently going out for a trust-wide ANPR tender, which will be next month. We're looking at how we can do more work in making availability for our blue badge holders. We're looking at further communication for our patients and visitors, and all of which has to be in line with our sustainability targets and our overall agenda with reducing the traffic in and out of our hospitals as well. So we've still got a long way to go. We've still got a lot of challenges, but at least we've started on the right foot, and we're getting that buy-in now from both staff and patients there.